Kyprolis Vial is a medication used to treat a specific type of cancer called multiple myeloma. It works by slowing down the growth and spread of cancer cells in the body. The dosage and timing of this medication should be determined by your doctor based on your specific medical condition. It is important to follow the instructions provided by your healthcare professional for the best results. When using Kyprolis Vial, it will be administered as an injection into a vein by a healthcare professional. This process is typically done as directed by your doctor, and may take anywhere from 10 to 30 minutes. The dosage will be determined based on your body size, lab tests, medical condition, and how you respond to the treatment. It's important to note that this medication can sometimes cause a serious reaction during and up to 24 hours after the injection. If you experience symptoms such as chills, fever, flushing, trouble breathing, joint/muscle pain, chest pain, or fainting, it's crucial to inform your doctor right away. In some cases, your doctor may prescribe other medications, like dexamethasone, before each dose to help prevent serious side effects. Be sure to carefully follow your doctor's directions to ensure your safety and well-being. Some common side effects of Kyprolis Vial include dizziness, lightheadedness, nausea, vomiting, diarrhea, constipation, and tiredness. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. While using this medication, serious side effects may occur, but your doctor has prescribed it because the benefit to you is greater than the risk of side effects. Some serious side effects to watch out for include severe headache, easy bruising/bleeding, numbness/tingling of arms/legs, fainting, fast/irregular heartbeat, symptoms of heart failure, signs of liver disease, mental/mood changes, and elevated blood pressure. Carfilzomib, the active ingredient in Kyprolis Vial, may also cause side effects due to the rapid destruction of cancer cells. Your doctor may prescribe additional medication and advise you to drink plenty of fluids to lower your risk. Symptoms of this include low back/side pain, signs of kidney problems, and muscle spasms/weakness. This medication may also increase your risk of a rare but serious brain infection. Get medical help right away if you experience symptoms such as clumsiness, loss of coordination/balance, weakness, sudden change in thinking, difficulty talking/walking, seizure, or vision changes. Other serious side effects to watch out for include sudden pain/swelling/redness in the legs, chest/jaw/left arm pain, trouble breathing, weakness on one side of the body, trouble speaking, black/bloody stools, vomit that looks like coffee grounds, and signs of infection. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. Before taking Kyprolis Vial, make sure to inform your doctor if you have any allergies or if you have a history of heart disease, high blood pressure, kidney disease, liver disease, or certain viral infections. This medication may increase your risk of getting infections or worsen current infections, so it's important to avoid contact with anyone who has a contagious illness. You should also inform your healthcare professional before getting any immunizations or vaccinations and be cautious with sharp objects and activities that may cause injury. Kyprolis Vial may cause dizziness, so it's important to avoid alcohol or marijuana while using this medication. You should also be cautious with activities that require alertness, such as driving or operating machinery. Inform your doctor about all the products you use before having any surgery. If you are pregnant or planning to become pregnant, do not use Kyprolis Vial, as it may harm an unborn baby. Women should inquire about reliable forms of birth control during treatment and for 6 months after the last dose, while men should inquire about reliable forms of birth control during treatment and for 3 months after the last dose. Breastfeeding is not recommended while using this medication and for 2 weeks after stopping treatment. Be sure to consult your doctor before breastfeeding. It's important to be aware of how Kyprolis Vial may interact with other medications, as this can affect how well it works and may increase the risk of serious side effects. It's important to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Kyprolis Vial are other drugs that weaken the immune system or increase the risk of infection, such as natalizumab and rituximab. Be sure to discuss any concerns with your doctor. If someone has taken too much Kyprolis and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, residents can contact their provincial poison control center. It is important to undergo lab and medical tests while using Kyprolis Vial. These tests may include kidney/liver function tests, blood potassium level, blood pressure, and a complete blood count including platelets. It is crucial to keep all medical and lab appointments. Be sure to take Kyprolis Vial as directed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist to determine the best course of action. This medication, Kyprolis Vial, is given in a clinic and should not be stored at home. It is used to treat a certain type of cancer called multiple myeloma. It is given by injection into a vein, usually over 2 to 10 minutes, by a healthcare professional. The dosage is based on your medical condition, body size, and response to treatment. This medication is usually given twice a week for 3 weeks in a row, followed by a 12-day break. The timing of when to take this medication will be determined by your healthcare professional. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.